Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we are going to be talking about CrossBIte. Let's start. So today's episode is going to be about CrossBIte of the teeth at a glance, because I can't go into detail because it's a very methodological science. So CrossBIte is basically ideally when your teeth are supposed to bite together. Your teeth are supposed to have some set of inclines, cusps and fossae in which they are supposed to interdigitate. Usually the cusps, that means the pointed part of your upper teeth, are supposed to fall into the midline fossae of the lower teeth, and that's how the normal digitation or the intercuspation is expected. But however, sometimes it happens that there is a CrossBIte. That means it either does not fall, the tooth cusp does not fall into the fossa, it either falls way inside, or it falls on one side, it falls inside, or it doesn't fall inside at all. So this is known as CrossBIte. Now there are two types of CrossBItes. You can have, in terms of location, you can have an anterior CrossBIte. That means your one or more teeth from the canine to canine are in CrossBIte, or you can have a posterior CrossBIte. Also, if you want to broadly classify a CrossBIte, you can have a dental CrossBIte, skeletal CrossBIte, or a combination of both, or even a pseudo CrossBIte. Now usually when you have a dental CrossBIte, that means that the teeth are present in such a manner that they are not intercuspating properly. Skeletal CrossBIte is where the growth of the maxilla is deficient, or the mandibular growth is more, so that the teeth of the mandible actually end up housing the teeth of the maxilla, and that's how you create a CrossBIte. And you can have a combination, or you can have a pseudo CrossBIte where you have an occlusal interference. That means the teeth are supposed to interdigitate, but while you're doing sidewise motion, because of some occlusal interference, there is a creation of a CrossBIte because of the fact that there is some stop that is stopping the teeth from interdigitating or intercuspating properly. Now usually CrossBIte is usually seen in primary dentition and mixed dentition, and it is best if it's caught early. And the causes can be a lot, especially around skeletal. It could be that the patient was a previous patient of cleft lip and palate that was operated at the early stages of life, and that's why the mid facial growth was inhibited. That could be one of the causes of skeletal CrossBIte. For the dental, especially anterior CrossBIte, you can have various causes such as trauma, the delayed exfoliation of the upper milk teeth or the deciduous teeth, and the delayed eruption of the permanent anterior teeth, which are palatal. That means they come behind, way behind than their normal position that they're supposed to, and that can create a CrossBIte. You can have other causes such as trauma and all those things, some sort of developmental anomalies. Even in cases where you have adenoid breathing, as in mouth breathing, and you have adenotonsillar movements and breathing that is severe, you can have CrossBItes. And also patients with cerebral palsy or muscle hypotonia can have CrossBItes. Now how do we treat it? The first important thing is, one more thing that I would want to talk about is, a lot of times the CrossBItes are actually related to environmental factors such as non-nutritive sucking or bad oral habits of kids, such as thumb sucking or digit sucking, because of which they create such kind of a pressure, because of which the above arch, the maxillary arch, becomes narrow and it collapses because of the negative pressure, and that's why you end up having a CrossBIte. Now if such is the cause, you have to first treat the cause. You have to treat the habit, you have to take care of the habit breaking appliances, you have to make sure that the habit is taken care of. Also, you will have to have, if you have a narrow maxilla, especially in growing children, you have the opportunity of expanding the upper or maxillary arch, which is known as expansion. You can have a slow expansion, you can have a rapid maxillary expansion, depending upon the case. You have different types of appliances such as quad helices and all those things. That is not the purview, but main thing is that it has to be caught earlier and earliest as possible, and make sure that it is taken care of. Why? Because it has ramifications if it's not treated, especially posterior CrossBItes, because posterior CrossBItes are seen more prevalent than anterior CrossBItes, and that can cause problems because of the fact that if there are posterior CrossBItes, you might end up having occlusal interferences, which might lead to bruxism. Bruxism is the gnashing of teeth together, and which can lead to the problem of you having TMJ dysfunction. That means you can have soreness and tenderness in the temporomandibular joint. On top of that, especially around parents who are very conscious about their kids' aesthetics, If it's a growing kid and the patient is having a posterior crossbite, you might have the chin deviation towards that side, and that might give you a facial asymmetry kind of a thing. Now, what you really need to understand is that most of the times it is orthodontic therapy that is helping in kids, especially around growing kids. But if it's around kids who have habits, the habits need to be broken. On top of that, you have non-orthodontic methods such as tongue blades. When you have single tooth crossbites, that means only one tooth is in a crossbite with its antagonistic counterpart, then you can have these non-orthodontic things. Otherwise, you can use appliances, orthodontic appliances. Meanwhile, it is very important for me to tell you that if you're an adult watching this video and you have a crossbite, you will have to get a comprehensive dental examination done. You'll have to check all of your things, inclusive of all your skeletal muscles, your dental complex and everything, and most likely you will be a candidate of braces. That means fixed mechanotherapy. That means you require braces, the wire dental braces treatment, along with, if not the least, you might have to go for, if it's a very severe crowding or severe a crossbite, you might require the extraction of some teeth. That depends upon the discretion of the operating dentist and the case selection that has been taken for purview. So you have to understand that if you're an adult watching this having posterior or anterior crossbite, it's absolutely necessary that you get an evaluation done with your orthodontist, get the tests done, get the x-rays done, get a cephalometric analysis done, and you will get to understand what is the problem, what is the arch width discrepancy, why is there a thing. You'll have to go through a root cause analysis sitting with the dentist, and then they'll probably tell you the solution, what are the feasible options with whatever ramification that they may have, and you can go for your fixed mechanotherapy and go for the crossbite correction. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients. Just drop me a message on WhatsApp with your name, your location, and the common oral health problem that's causing you discomfort. And within a couple of days, please be patient. I will respond to you. It might take some time. Sometimes it takes even a week for me to respond, but I do respond to all of my patients' queries on WhatsApp. And if you have any queries, doubts, apprehensions, or insights, you can still put them in the YouTube comment section and we can have a chat on the comment section. So that's it for today. Thank you.